How to be prepared for the new E&M. Things in the evaluation and management game are changing, and you must be prepared. In this video, I will introduce you to the new definitions in CPT for E&M to be successful and to be prepared. To stay abreast of the changes, subscribe to my channel and hit the bell for notifications when I upload new videos. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. The 2020 Medicare Physician Fee Schedule indicated that all we have known regarding evaluation and management coding will change in 2021. In this video, I talked about some of the new changes and introduced you to vocabulary. I will follow up and continue with the definitions in this video. Stay tuned until the end of the video, and I will give you a peek at the level of medical decision-making table. Oh, what joy. These definitions are for the elements of medical decision-making for office or other outpatient services. Acute illness with systemic symptoms is an illness that causes systemic symptoms and has a high risk of morbidity without treatment. For systemic general symptoms such as fever, body aches, or fatigue in a minor illness that may be treated to alleviate symptoms, shorten the course of illness, or to prevent complications, see the definitions for self-limited or minor, or acute uncomplicated. Systemic systems may not be general, but may be single system. Examples may include pyelonephritis, pneumonitis, or colitis. Acute complicated injury is an injury which requires treatment that includes evaluation of body systems that are not directly part of the injured organ, the injury is extensive, or the treatment options are multiple and or associated with risk of morbidity. An example may be a head injury with brief loss of consciousness. Chronic illness with severe exacerbation, progression, or side effects of treatment. The severe exacerbation or progression of a chronic illness or severe side effects of treatment that have significant risk of morbidity may require hospital level of care. Acute or chronic illness or injury that poses a threat to life or bodily function. An acute illness with systemic systems or an acute complicated injury, or a chronic illness or injury with exacerbation and or progression or side effects of treatment that poses a threat to life or bodily function in the near term without treatment. Examples may include acute myocardial infarction, pulmonary embolus, severe respiratory distress, progressive severe rheumatoid arthritis, psychiatric illness with potential threat to self or others, peritonitis, acute renal failure, or an abrupt change in neurologic status. Tests are imaging, laboratory, psychometric, or physiologic data. A clinical laboratory panel, for example, the basic metabolic panel, which is CPT code 80047, is a single test. The differentiation between single or multiple unique tests is defined in accordance with the CPT code set. External records, communications, and or test results are from an external physician, other qualified healthcare professional, facility, or healthcare organization. An external physician or other qualified healthcare professional is an individual who is not in the same group practice or is a different specialty or subspecialty. It includes licensed professionals that are practicing independently. It may also be a facility or organizational provider, such as a hospital, nursing facility, or home healthcare agency. Independent historian is an individual, for example, a parent, guardian, surrogate, spouse, or witness, who provides a history in addition to a history provided by the patient, who is unable to provide a complete or reliable history, for example, due to developmental stage, dementia, or psychosis, or because a confirmatory history is judged to be necessary. In the case where there may be conflict or poor communication between multiple historians and more than one historian is needed, the independent historian requirement is met. Independent interpretation. The interpretation of a test for which there is a CPT code and an interpretation or report is customary. This does not apply when the physician or other qualified healthcare provider is reporting the service or has previously reported the service for the patient. A form of interpretation should be documented, but need not conform to the usual standards of a complete report for the test. The definition for an appropriate source. Well, for the purpose of discussion of management data element, an appropriate source includes professionals who are not healthcare professionals, but may be involved in the management of the patient. For example, a lawyer, parole officer, case manager, or teacher. It does not include discussion with family or informal caregivers. Risk is the probability and or consequences of an event. The assessment of the level of risk is affected by the nature of the event under consideration. For example, a low probability of death may be high risk, whereas a high chance of a minor self-limited adverse effect of treatment may be low risk. Definitions of risk are based upon the usual behavior and thought processes of a physician or other qualified healthcare professional in the same specialty. Trained clinicians apply common language usage meanings to terms such as high, medium, low, or minimal risk, and do not require quantification for these definitions, though quantification may be provided when evidence-based medicine has established probability. For the purposes of medical decision-making, level of risk is based upon consequences of the problem or problems addressed at the encounter when appropriately treated. Risk also includes medical decision-making related to the need to initiate or forego further testing, treatment, and or hospitalization. Morbidity definition is a state of illness or functional impairment that is expected to be of substantial duration, during which function is limited, quality of life is impaired, or there is organ damage that may not be transient despite treatment. Social determinants of health. Economic and social conditions that influence the health of people and communities. Examples may include food or housing insecurity. Drug therapy requiring intensive monitoring for toxicity. A drug that requires intensive monitoring is a therapeutic agent that has the potential to cause serious morbidity or death. The monitoring is performed for assessment of these adverse effects and not primarily for assessment of therapeutic efficacy. The monitoring should be that which is generally accepted practice for the agent, but may be patient-specific in some cases. Intensive monitoring may be long-term or short-term. Long-term intensive monitoring is not less than quarterly. The monitoring may be by a lab test, a physiologic test, or imaging. Monitoring by history or examination does not qualify. The monitoring affects the level of medical decision making in an encounter in which it is considered in the management of the patient. Examples may include monitoring for a cytopenia in the use of an anti-neoplastic agent between dose cycles, or the short-term intensive monitoring of electrolytes and renal function in a patient who is undergoing diuresis. Examples of monitoring that does not qualify include monitoring glucose levels during insulin therapy, as the primary reason is the therapeutic effect, even if hypoglycemia is a concern, or annual electrolytes and renal function for a patient on a diuretic, as the frequency does not meet the threshold. These definitions are part of the new medical decision-making guidelines for office and other outpatient service codes 99202 through 99215. In the past, there was not a one-to-one correlation between the new and established office visit E&M codes. Well, as you see on the new table, they are now grouped together. So regardless if the patient is new or established, a low level of medical decision making along with a medically appropriate history and or exam will give you a level 3 service. Now that is interesting, and stay tuned on that one. Next week, I will review the time guidelines as they now may be used to select a code level in the office or other outpatient service, whether or not counseling and or coordination of care dominates the service. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information and strategies on these tips and others on how to become a certified marketable medical coder, then check out these videos. And check this out. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Feel free to subscribe to our channel and click the bell for notifications when we upload new content. I love hearing from you, so let me know you were here by providing a comment. And let me know what your takeaway is regarding these new definitions. Let's stay connected and connect others as well. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.